Welcome to yet another special edition on palliative care. My name is Sofie Matovu. We're still down in Lira City and we promise we're still going to take you through a lot. Now, I'm made to understand that one of government's directives to all the health public schools is that palliative care has become a course unit that is taken very seriously. Now, we take a bit of a story and follow into a private school in Lira City, and the school is none other than Jerusalem Institute of Health Sciences. Join me and let's get to hear more about the stories within the institute. Palliative care is integrated in the 2015 to 2020 Uganda's health sector strategic or development. Palliative care is also included in the mission statement of the National Health Policy as well as within the minimum health care package for the country. The integration of palliative care into the educational curricula of healthcare professionals in Uganda has facilitated its application into the mainstream healthcare. This includes a national palliative care training manual recently developed by the Ugandan Ministry of Health for healthcare providers at all levels of service delivery.
My name is Anamo Harriet Odong. I'm a teacher in this school. As we are training the health professionals in the school, it was seen by the health body that it was very proper to have the health workers train in the palliative care management because of the overwhelming situation on the ground where we have the cancer patients dying and people are not supporting them to have a peaceful journey mercy in what they're suffering from. It has brought a lot of misconception about people suffering from cancer and HIV. When it reaches a certain point, they may think that the relative, the family members may think maybe they were bewitched or something, or some other people are following their relatives in a bad way. Yeah, so the ministry thought it twice that it should be one of the components in the training of the health professionals so that when they are giving a service outside, they should be very much aware of the situation on the ground and they should be able to counsel them, to talk to them, to know what is actually on with their relative or the person who is suffering. And also to prepare them to have a set mind to, palliative is a course unit which is introduced for people who have terminal illnesses. So when you, a sickness which the drug cannot treat, the drug alone cannot treat. So there are very many elements to be captured and to prepare the person to live or to talk to the family members, disclosing possibly what he or she has for the family, like if they have the asset, they want to prepare them to write a will to leave the family so that a person have a peaceful set off in life. Since we started introducing in this school particularly, it has been like a scaring course unit whereby the student would think about talking about death. And death is something which most people feel it is so touchy, so scaring. So in the teaching, first set the platform to ensure them to build the confidence in the course unit. Thereafter, when they build the confidence, they will see that it is actually very important in their cost, because they are dealing with health issues whereby there is healing and there is death. So they should know that as much as they are qualifying, they are going to meet death in wherever they are going. So that one, you have to lay off the anxiety of the death. Then, after anxiety has been laid off, and telling them the importance why they should know about palliative care, eventually they pick up. But from the beginning, day one of introducing, like giving the overview and everything, you find that some student who might have had or undergone through those kind of challenges, they have lost their relatives out of those terminal ill diseases, they will start crying even in class, recalling the pain which they underwent. And throughout teaching, they may think that if this one was already in place, having the knowledge about how to go about with it, they would also play a very big role in talking or preparing their people to go in a very peaceful way and to avoid wrangles in the family. So as we go along through the teaching with them, and not only that, they start now building a confidence in palliative, looking at it as it is a course unit which cut across all the course unit which is being taught in health, because there's nobody who is going to live for life. People are going to die. And in the community where they are going to serve, like a health unit, there are people of that caliber who needed to be attended to, and they should have the knowledge, the skills, and the attitude of attending to those who are in need.
My name's Edward Muzee. I always prefer being called Muzee, Edward Atim. I'm a senior tutor here now, but earlier on I had been the first principal of this very school, which I performed up to 2 years ago, when I now said, no, let me rest. But at the moment I only help nurturing these people and teaching also a few subjects around. So my presence here is actually to boost the morale of the tutors who are around. That's what I'm doing. Palliative care, I got to know it when it featured in our curriculum. Because in the curriculum of clinical medicine, they are supposed to do palliative. And it is a full course unit. You fail it, you don't proceed. So we looked around, and it was not very easy to get somebody who could do that. But we were blessed that we had a very good friend of mine who was working in Lira Regional Referral Hospital as a palliative nurse. So as a good friend, I contacted her. She readily accepted and came and started helping us with the palliative care. But before that, I didn't know about it. You know, I'm a clinical officer, yes, but during our time, we didn't go so much about the palliative. So I had very little knowledge about it. But when she now came in, I was a little bit inquisitive. Then I got to know what it means, such that I didn't know in the course of time it would be useful to me. It turned up to be like that. I ended up being a customer to her, a client to her in the course of time. When I was already here, I was a little bit unlucky. Yeah, but it was God's will that I had a boy, my firstborn, turned up to be a sickler. And this sickler, towards the end, when he reached about 20 years old, he started developing some queer pain, which was not very easy to handle. So we got completely mixed up until when I was referred to our office, to our unit. Then she started putting this young boy on some medication. Counseling first and then medication. And for sure, I can assure you, that was the time we rested. We had a difficult time with this boy, and not only for a year or two. It was a number of years that sometimes at night we are seated. There's no way you can cool. When the pain is aggressive, it's not very easy to handle. But when we now came into contact with her and she put this patient on treatment, that was the time we rested. Because the pain would come, yes, but it would be, we were told how to handle it medically. Medicine was available, and that assisted us. Although, of course, towards the end, at the age of 26, he got complications, you know. With the sickle cell, sometimes you get some complications that you may not come out of it. Eventually, he died, but died a comfortable boy, with a painless boy and a happy man. Which I thought if we didn't have such a medication, it was going to be chaotic. That was what I saw.
I'm Kutosi David, and I'm a clinical instructor at this institution. I was once a student here from 2016 up to 2019. And around 2017, 2018 is when we were doing palliative care as a course unit. And I really learned a lot, and I benefited a lot from it. One, it helped me to modify my attitude towards the care of patients, especially terminally ill patients. And then also it improved my skills on how to interact with the patients, especially those with the chronic illnesses, such as cancer, diabetes, and the rest. It was my desire, but the opportunity to be retained came, and I volunteered some time back in Health Center 4. But when the opportunity called, I decided, let me try this opportunity. But still, nevertheless, I still teach others, and I still encourage others to follow the same line and to help others also to know more about palliative care. When I was volunteering in Health Center 4, we used to conduct health education, health talks, and I could reach out to the community members, even where I stay currently, in my neighborhood. Sometimes I try to encourage people and tell them more about palliative care, about the need for the care of the terminally ill and those who are severely ill. And initially, the first reception when you introduce the course unit or when you are teaching palliative care, at first people are fearful and people are not so sure of what you are going to discuss or you are going to present to them. So they have a lot of misconceptions about palliative care. For one, someone will tell you, I think it is the care for the elderly, maybe outside the country, that's why you need to know about it. Others, like you have just mentioned it, people fear death. When you associate anything with the death, they tend to panic. But eventually, by and by, as time goes on, as the lessons goes on, they pick up interest, and the majority of them have been eager to pursue it even further. What I would like to encourage everyone out there who is listening or watching is that palliative care is not only meant for health workers, but all of us, we are part of the palliative healthcare team. And because most of these people we manage or we care for are with us in the community, most of them, they are not managed in the hospital setting because of their conditions. So I encourage everyone to embrace, love, and care for these people.
I am Senile Amon. I'm a clinical instructor here in the institute. I was once a student here from 2016 up to 2019. I did palliative care in this school in the year 2017, and I excelled very well. I enjoyed palliative care personally because it gave me a wide spectrum of knowledge on management of patients. Before palliative care, you think patients are managed physically with drugs and the rest. But when I started palliative care, I reached the psychological aspect of it. I realized when we are managing pain, pain may not reduce if we don't do something like counseling, talking to the family, and talking to the patient himself or herself. So palliative care opened my understanding about management of patients. Yeah. So having understood it, I passed it very well. I was also retained in the same institution. Though I don't teach it, but I still enjoy it. The one major thing that made me excel is the time I went to the hospital. I reached the palliative care unit. I realized there is a gap there, and how patients were being managed. In class I studied, they are managed, most especially pains. We give those strong analgesics like morphine. But I realized the little time I spent there, there's some other aspects that could come in as they are being managed, talking to them, making them feel they are needed, still needed, like in the hospital or even in the community. So I realized palliative care is something that all patients should be given to. However much their condition is bad, but it can help them. So I also, it entered my heart that in the future, if I'm to excel, I can as well upgrade in palliative care, continue giving the services, those indeed services to the majority of those patients. Yeah, so palliative care is a good thing for patients other than these other medical therapies we give them. So I developed interest in it, I read it, and the teacher was also a good one. My teacher, Madam Philomena. So she taught me very well. We understood, and I was the class president by then for that program. So I used to interact with her much, and she told me much about palliative care. That's how I developed interest in it. My remaining here was entirely also to help my fellow young people or the youth also excel in such things. Much as I don't teach palliative care, but if I'm given a chance, I think I can do it better. I want to impart knowledge into them so that a wide spectrum of knowledge is spread that can reach other communities. Though I've reached only one hospital, that is the regional referral hospital. The others, I don't know much about it, but for the health centers I've reached, like Health Center Falls, even some district hospitals, not only in Ilira, but other districts. Palliative care is not there. It is only in regional referral hospitals. You reach there, you don't find even a unit. Sometimes you may fail to get it. If at all the unit is there are no supplies and there are no clients. So you wonder if there are patients in such units or not. But me as a clinician, I know they are there, though they are not taken care of. So I think palliative care should be also extended to the lower levels, apart from regional referral hospitals. My final comment about it is that palliative care is something so important in the community. And if there is a possibility that the government could implement, palliative care can be extended to the grassroots levels, even if it is extended to the community, because we have counsellors. Such people can give services. It should not be based only in the higher levels of health care. It needs to be something that is tangible even at the grassroots, so that patients get that best care. So that the time they are coming to regional referral hospitals or national referral hospitals, they are just coming for the most specialized services.
Palliative care is that, this is what I'm going to say about palliative care. I think palliative care is not yet even in depth. It is not practiced deeply. If there was a way that it could be done in such a way that it would wave off the stress of death, I think it would be the best thing, really. Not even in Europe. I am very sure even in Europe there is still a gap somewhere. But I think in about 500 years or 1,000 years, time will come when people are not going to fear death. This is what I'm thinking. It keeps on ringing in my mind. In about some years to come, people will not fear death, because death itself is not painful. No. Actually, the most comfortable thing in this world is death. Others can come next. I always try to equate it with sleep. When you are sleeping and you don't have bad dreams, you see how sweet the whole thing is. But that is only sleep. Now how about death, which will make you sleep completely and you don't feel, you don't hear anything, it would be a beautiful thing. But then the fear of death is that the process, if it could be worked on, it would be something would like people, everybody would want to die, even earlier than they are supposed to die. Because it is where people go and rest permanently. What's wrong with that? And in any case, who tells you that you are going to suffer there? You even don't know whether you are, if they ask you, why do you fear death? They will not even answer it, by the way. Even me, when I ask myself, Edward, why do you fear death? I don't know the answer. Because it is not painful, it is not what, then what is that you are fearing? The little I can say is that it causes me stress. But if stress could be handled, I think that would be a beautiful thing. Just stress, that psychological aspect. If it could be handled, one time these white men will get drugs that will remove all the anxiety, and you will see somebody who is dying will smile when dying. That is it.
My last comment in palliative care in this institution, according to how I'm teaching and how the students are getting the concept of palliative care, I feel the school, the institution should realize with the training body to initiate purely the palliative care personnel to be trained as a palliative care personnel specifically, and they award them the certificate for palliative care, so that it has impact in the community, and they can also be employed in the health facility as palliative care professionals to handle those specific patients who are in need of, and the family, the community, every stakeholders.
Several nurses, doctors and social workers have been trained in different districts all over the country. Several structures have started recognizing the need for palliative care, and there is a growing demand for the package. All regional referral hospitals as well as health center 4s should be able to offer this service. Well, need I say more? Like you have seen or heard the stories, trust me, it is the way to go. Palliative care is something that we've been discussing for quite a while, and we've gotten to realize, I think this is a service, or this is something that they need to even educate the VHTs about, so we are all able to easily access these services as and when we need them. But surely now you can see government has taken it a step further, with private schools and also government schools having palliative care as a course unit. Trust me, we will be able to access the services or the help that we need at the doorsteps as and when we need it.